A couple of years ago, I accompanied my mother to a doctor's appointment she had. She asked me to go with her because she was having some questionable moles checked out and she was nervous. Waiting for the doctor, although nervous myself, I remember trying to convince her she was going to be fine. Even though I could tell she was anxious, she nodded along with me. When our doctor finally came in, he took a quick scan of her and said she had nothing to worry about. So, relieved, we left. 2 years later, at a routine checkup with a different doctor, she was informed that one of her moles looked suspicious, and test results revealed that it was, in fact, a cancerous mole. According to Archives of Dermatology, skin cancer is the most common form of cancer in the United States. Each year, there are more new cases of skin cancer than the combined incidences of cancer of the breast, prostate, lung, and colon. Furthermore, 1 in 5 Americans will develop skin cancer in the course of a lifetime. So, why do some continue to lay out in the sun for hours? The research is evident. Some believe the misconception that tanning beds or indoor tanning is safer than natural sun. The reality is quite the opposite. On the average day, more than 1 million Americans use tanning salons, giving the indoor tanning industry an estimated annual revenue of $5 billion. According to the U.S. Department of Health and Human Services, ultraviolet radiation is a proven carcinogen. A carcinogen is a substance that is capable of causing cancer, like cigarettes or numerous exposure to harsh chemicals. Frequent tanners using new high-pressure sun lamps may receive as much as 12 times the annual UVA dose compared to the dose that they receive from sun exposure. And since 71% of tanning salon customers are girls and young women ages 16 to 29, it is important to be aware that first exposure of tanning beds in youth increases melanoma by 75%. Melanoma is the deadliest form of skin cancer. The survival rate for patients whose melanoma is detected early, before the tumor has penetrated the epidermis, is about 99%. The survival rate falls to 15% for those with the advanced disease. To better understand how deadly melanoma can be, it is important to know that more than 20 Americans die each day from skin cancer, primarily melanoma. One person dies of melanoma almost every hour, according to the American Cancer Society. Is dark skin worth the risk? You're risking your life for dark skin, and you have to ask yourself if it's worth it. Of course, we cannot avoid sun exposure completely. However, there are steps to take to lessen your chances of getting cancerous cells. First, you can check yourself and be aware of new moles and spots. The most common warning sign of a skin cancer is the change in appearance of skin, such as a new growth or a sore that will not heal. It's important to look everywhere on the body because 20% of skin cancer occurs in areas that are not regularly exposed to the sun, such as the chest, back, legs, and scalp. The two most common forms of skin cancer are basal cell sarconium and squamous cell sarconium, which is what my mother was diagnosed with. Squamous cell sarconium usually begins as a small dome-shaped bump, and they are often covered with small superficial blood vessels. The texture of the spot is often shiny and translucent, sometimes referred to as pearly. Basal cell sarconiums often appear on the chest and back and look more like patches of raw, dry skin. After you have been checked over, you can also avoid unprotected sun exposure during peak radiation times. Wear broad-brimmed hats and tightly woven protective clothing while outdoors, and regularly use waterproof sunscreen with an SPF of 30 or higher. Make sure to reapply at least every 2 hours. However, when diagnosed with the type of skin cancer, there are many ways to treat it, all of which are unpleasant. The one that I have the first hand is called curettage, which is what my mother experienced. And it consists of scooping out the cell by using a spoon-like instrument. The tumor is cut out and stitched up. It's very weird to see my mother with literally a chunk missing from the back of her calf. She said the treatment was very painful. Thankfully for my mother, she continues to be cancer-free but is checked on every 6 months for new spots and moles. So you have to ask yourself and the people you love if dark skin is worth all the pain. Is it worth it?